300 plus die without insurance.
As much as we would say we want it to go down or we want the government to provide everything, it is not possible.
Insurance industry is a scam.
Is that also, the cause of all these health issues that's rising in Malaysia?
Hello everyone, you're watching Beyond the Headlines. My name is Amalina Kamal, and today we're asking a simple yet critical question. Can Malaysians still afford to be healthy today and for the years to come? Joining me to keep the flow of the discussion is Business Times' very own news editor Sharen Kaur. Sharen, welcome to the show.
Thanks, Amalina.
Thank you. I'm glad that you're here.
Yeah, I'm so glad to be here as well to discuss two very hot topics, insurance and healthcare. Yeah.
Healthcare, right? I mean, it's a very hot topic because today a lot of diseases and sickness, and I do believe that the general public, they don't necessarily know how to assess certain, I suppose, treatments even, right?
Right.
And
True.
So this is why we're here. I do have a question for you.
Okay.
When you think about healthcare, right, do you think it's just about keeping up with your doctor's appointment, and when you go to the hospital, you're treated with 5-star service?
I think it's more than that. It's about it's everything about where we work, what we eat, and whether our insurance actually covers us, especially after retirement. I think that's really very important.
Right, and not a lot of people do have actually insurance these days, right?
Yeah, and they don't understand the importance of having insurance. So that's
Especially
the issue right
nowadays.
now.
Yep, and that's why we're here. We're going to be asking the bigger questions. So we'll be looking at global pressures to local interventions that could actually work. And because of that, we have two special guests here today. First up, we've got Rhenu Bhuller, a global strategist who spent more than 25 years, transforming the healthcare system in the Asia Pacific. Welcome, Rhenu, to the show.
Thanks so much for having me. Great to be here.
So I understand that you have knowledge, especially when it comes to AI interventions to, policy making, especially in healthcare, right?
Well, let me put it in context. So I have been working into looking at what are the different forces that influence healthcare, how we access healthcare, what is actually available to us, what it costs not just to us but to our healthcare systems around the world. I've been very fortunate to have worked with, across, I would say, the spectrum of the healthcare value chain, from pharmaceutical companies to, business consulting and research, to even not-for-profits and the public sector across 5 different countries.
Exciting.
Yeah, I would count myself very fortunate to be to have been able to see and compare and actually learn in real life about all of this.
Brilliant. So we're going to be discussing more on that, and you can share a little bit more about your experience. So next to Rhenu, we also have Ravinder Singh, who is an actuary, reinsurer, president of the Malaysia Towerrunning Association. Ravinder, thank you for joining us today. Pretty exciting.
Yes, I'm looking forward to it. Thank you.
A little birdie told me that you just run a particular tower here in Malaysia, in Kuala Lumpur specifically. Maybe you can enlighten our audience?
Yes, certainly. On the 30th of August, we have a first race at Merdeka 118. So the last few days, I've been testing the stairs of Merdeka 118. So I've been climbing 118 floors a couple of times.
And how often do you climb towers, though?
Yeah. I mean, I live in PJ in a condominium that is 46 stories tall. My condo is on the 43rd story. So I climb 200 floors every day.
Wow. So you never take the lift?
When I have things, I obviously change to sports gear and do it as a sport. Normal time I would take the lift, but when I'm ready for the exercise and the challenge, then I'll wear my sports gear, and then we just walk up, we take the lift down, and then we walk up again.
Way to go. I mean, I do understand that you're also a preventive sort of wellness advocate, right?
Yes.
That's a lot, an area that not many people understand. Maybe we can go into that if you don't mind.
Actually, this whole thing started 18 years ago. I met in an accident in PJ driving home. Actually, it was my 41st birthday. A car hit me from behind. We stopped at the side of the road. While we were sorting out, another car came and hit all of us. One person died and 7 were in hospital. I was 1 feet away from the guy who died, and I was walking away from him. So if the accident happened half a second earlier, I wouldn't be here today. That was a life-changing experience. That time I was a single father. My son was 7, my daughter was 4, and I didn't have much insurance. Even though I work in the industry, I didn't think I would need it.
Okay.
So
okay.
that was life changing. So then I kept asking myself why I was there and why I survived. And the answer I got was that I needed to find a solution to make sure every Malaysian is insured. So from there, I developed the concept to try to solve solutions to people when they are the lowest in their life. And somebody is lowest in their life is when they had a death in the family or when they are told by the doctors that they have an illness that can't be cured. So that's where I try to find solutions to bring them back up, to give them hope.
Right.
Okay.
No, this is pretty. I mean, thank you so much for sharing, and
Yeah.
I do want to say sorry for the experience that you had to go through, but it's certainly an opportunity for you to be sharing why you do what you do today and what's your calling, especially when we look at the context of addressing the gaps in healthcare, especially in Malaysia, right? So let's start the discussion with something big, right? Around the world, our healthcare systems are actually under enormous strain now from the aging population, which Malaysia is very much faced. I mean, we're so familiar with it, right? We hear the buzzword today, but not
buzzword
many
today,
people
yeah.
actually understand what the situation really is. Chronic diseases, rising costs, and tech burnout. Renu, we go to you first. What do you think our sort of status is like right now? Are we managing it, or are we actually going into a deeper sort of like crisis?
Well, I think that it's not just a Malaysian, it's not unique to Malaysia. Every healthcare system in the world today is facing what we call turbulent times. It's kind of that perfect storm, that storm of, as you know, you talked about the aging population coming in and rising chronic diseases, technological advancement as well. And I think what we are seeing is different countries have different ways in which they are applying and coping with it. But more importantly, I think we do have the tools, the technology to be able to, I guess, mitigate some of this. It's just how we use those resources. And bringing all of that in is that whole angle of, I think Ravi mentioned, preventive care, because you can depend on a government to provide you with the tools. But also it's really important that we take what we call, our personal responsibility for health. And that starts at a very, very early age. So if you look at countries like South Korea to me is one of the really good examples that has used digital tools, technology, but also brought in the whole preventive healthcare perspective. There's mandatory personal, health. You have to actually go into a health check, but it's kind of a civic consciousness that I have to do it because it's important for my health. So I think around the world we've seen more and more shared systems, so public-private partnerships where you utilize potentially underutilized services in a private sector to support the public sector, which is really under pressure and stress. You see that. We see more healthcare in the home because it costs a lot to go into a hospital, right? You have to take not only for the patient, but you have to take the carer takes time of work, whether it's the father or the mother, whoever. The carer takes time of work. You're getting people on the road, so actually going out, and it's a whole day affair. So there is today technology that enables us to bring healthcare more to the home. So I think being able to utilize what is there, and also being able to manage the costs, which it is really astronomical. We're looking at more than $1 trillion industry from advanced therapies. We hear about advanced therapies coming into administrative costs and cost of implementation.
Right.
So I think all of that requires willpower, a really strong will to say, okay, we need to do this and we need to do this right, to stay the course. And it also requires collaboration and partnership, not just from healthcare providers, but from us as citizens and consumers.
Right. Do you think, just kind of to follow up to that, right? Do you think Malaysia has actually missed the boat in ensuring that our tech spaces, or at least infrastructure, is robust enough? When we go through COVID, we had the My Sejahtera, everyone was very digital savvy, right? And post-COVID, people just want to have things physically done. So that area is just left in the dark.
Yeah.
And how can we jump back on that?
Yeah, I don't think we've missed the boat because I started looking into digital health probably about 20 years ago. And at that time, naively, I thought, by 2025, we will be fully digital enabled and our whole healthcare system will be digitally transformed. We underestimate how much it takes to actually implement tech correctly. The user experience is so important. Interoperability, because when you look at even different hospital systems. They all don't speak to each other. So I think that, I think that tech today has advanced to the time where we have the right tools. We can learn so much also from other countries and their mistakes. We are actually a digitally savvy nation. I think as a nation, Malaysia is very tech savvy. Even more so, I would say, than some of the other countries, like even in Europe. So I think it's bringing that mindset into health. Now, our older population, they struggle because they are not as digitally literate. So you will find different pockets. So I think the key is to bring in, I would call your
mediators,
priority users today, right? Your young people,
right.
your below 65s. I don't want to put an age because I know 65-year-olds who are very savvy, but really people who are digitally savvy and trained and say, this is how we're going to do it. Now, when Australia implemented My Health Record, it was a disaster because many people didn't want to go into it. They were concerned about, someone's going to steal my data, and then I won't get a job, I won't get insured. So there were a lot of concerns around privacy and so on. They now have implemented their 2023 to 2028 digital strategy, where they've learned from those. Now you have to opt out, and they've looked at, okay, what is it? And they've brought in a consumer panel. So they actually, together with your policymakers, your healthcare professionals, and so on, you have a consumer panel to give feedback on what is it that the consumer needs and struggles with. I think it's the perfect time. I don't think we've missed the boat. I think the time is now.
Right, and I do agree because do you notice that when we talk about having to adapt ourselves to any sort of tech, right, ones that are much more easy for us to transition into are all these big brands. I'm not going to mention names, but it's a symbol of a fruit, right? For instance, like they're quite intuitive in a way. If you see their users or consumers, right, regardless of age, they're able to operate the watch quite easily whenever they want. When we talk about wellness tech, right? So it's also part, the R&D and the user testing is also part of ensuring this sort of like robust system, right? Yeah. So when we go to adapting to certain wellness tech, right, can I ask Ravin this particular question? Within your community, especially the runners, the climbers, how much do they depend on technology to help feed them with the right kind of information to tell that they're healthy or not?
I mean, I must say, when I was young, every time we got a new gadget, there was a manual that we had to read. Okay, then after a certain time, every electronic thing that you bought, there was no more a manual. You just learned how to do it. So for a start, it's so easy to use. Yeah, and for runners, measuring is so important. How long they ran, how fast, compared to the previous one, the heartbeat. Now even the sleep monitors are so critical to our everyday life, and they're helping us reach a higher level of health and fitness. So really, I think we're not too late, and Malaysia is adopting this. I see, I see my community having gadgets not even available in Malaysia yet, and they've got it.
They're ahead of the pack in that sense, lah.
Sorry, I would just like to add a question. So if you were to compare Malaysia with the rest of the world, especially like our immediate neighbours, where do we stand?
I wouldn't say we are front runners, but I would say we are there, maybe the top 20% of the world, we are there. So adopting technology is not an issue. Yeah, and I live in a condo, and I can see, goods delivered until there's no place to walk. So how are they doing it digitally?
Yeah, no.
And even back at the time when AirAsia first started, purchasing flight tickets online instead of through the travel agent, I thought, Malaysians won't do it. And then they were targeting the group that never flew before. And they had no problem. You give me a discount, I will find a way to do it.
But I think, coming to that, when you talk about comparing your neighbours, I totally agree with that. But an area where, and maybe our government's already looking into this, where I think we really do need to put a little bit more is in terms of our healthcare spend as percentage of GDP.
Right.
Because, I think we're about maybe less than 3% now.
Actually, for 2024, it's 4.3%.
Yeah. 4.3%. So good. Yeah. That's really good. And if you look at that, I think our comparison is we are starting to see between 5 to 7 in some of our neighboring countries. Now, obviously, if you go to countries like Switzerland, all you're looking like 10 to 12. Australia and Japan are around 7 to 9.
Okay.
So I think the good thing is we have improved, because it used to be less than 3. Now we've gone to the 4 to 5.
We're like halfway there.
Yeah, and I think if we can even get that, if in terms of being able to increase that slowly, but I'm not saying to extreme, but putting a little bit more and putting some of the investment in these areas, digital enablement, preventive healthcare. I think we really underestimate early diagnosis, preventive healthcare, educating consumers so that we don't have to spend on those expensive, hospital stays and procedures in later years.
Right.
Yeah, I mean, still on the AI, before we go into insurance, how do you think our hospitals are, keeping up with the trends of AI?
I think so AI is really broad, right? You can use it in many different ways. You can use it to test, for example, sneaker time. One of the things when you look at is our nurses and our healthcare professionals are overworked, understaffed. Our interns, our doctors who are working there, they even look at sneaker time, how much they actually have to walk throughout the whole day to get to all of that.
Sneaker time?
Yeah.
Sorry, what's that? That's
Sneaker
actually
time,
a
it's how
phrase.
much time that a nurse or a doctor or someone who's doing their internship is actually walking in their hospital sneakers and shoes throughout the hospital to get to whether it's a patient or I need to go and pick up a swab because it's not here. Those kind of little things, because if you actually have AI to show you, it can help align that. The other way AI is being used is when you look at understanding disease trends. So you have that as well there. You have a lot of AI being used in terms of early drug discovery. So I think the applications in healthcare and AI is huge. Are we applying that all here? Not yet. I think we're still very, very early days, very early days in Malaysia.
But we're also pretty skeptical, right, about AI and how much we trust AI.
Do you
Like
think-
the diagnosis
Do you
and
actually
things like-
think you can afford to live in a world without it?
Yeah.
You can't.
No.
Without you even knowing it's there, it's picking up what we speak. It's picking up on your phone. All those, when you look at the ads that you get as you're looking at, that's all AI, because they're like, oh, this person is looking to see which milk is better than that milk. Let's put an ad out for milk. So that is AI. So I think that we have to learn how do we utilize AI to help us improve our services, our healthcare systems, where we actually put our resources. I think that's what it is. It's how we use it, combining the human and tech interface.
Okay.
Sorry for cutting you off just now. You wanted to ask a question?
I know you actually kind of like asked that question already. Yeah.
Right.
So-
No, because it's like something that popped
Yeah,
into
it's
my
very
mind. 'Cause,
interesting. Yeah.
Anyway, we go to Ravin, because when we talk about like having to assess our health even way before we actually experience something very shocking, do you think Malaysians are actually very well prepared to deal with emergency cases? Are we knowledgeable enough in terms of what to do the first thing? Call your insurance agent, or is it call your family members first?
Call 999.
Yeah, or 999,
Yeah, I mean, I think for a start now, Mr. Google is there. You can Google and see, I have this problem, what do I do? But most of the time, we will call somebody that we are close to. If you are close to an agent, we will call an agent. If you have a health issue, we will ask something. We are quite resourceful. I think we are quite resourceful. And we will find the right way to get the answer. And especially the young generation, they are very good at Googling and searching themselves. So I think that's not really an issue. And I think today we don't really need to rely on agents so much, because agents have their guidelines of what they need to do or what they need to promote. And that not always works in your favor. So you need to make independent choices for yourself. It's better to talk to somebody, an experienced person within your circle who understands insurance, maybe a friend or a relative who works in industry, is a better source of information than an agent. Okay, so you get to understand the other way. And agents in Malaysia are linked to one insurance company. So the best solution might not be with that. And obviously, when you talk about insurance, online is a big proposition today, purchasing online. And I've been working on online insurance in Malaysia for 10 years. I started the first one in Malaysia, a platform called U4Life. Following that accident, because after that accident, the person who died was the only son in the family, and he didn't have any insurance. So I helped his family get some payout through the motor policy, which is not ideal. So really that was the trigger point for me that I need to make sure. 550 Malaysians die every day.
Every day?
Every day, 550 Malaysians. About 200,000 Malaysians die in a year. That it works out to about 550 every day. 300 plus die without insurance.
Wow.
So that's like more than half.
Yeah.
Yes, 60% Malaysians don't have insurance. The insurance industry in Malaysia is over 100 years old. And we all have the biggest insurance companies in Malaysia, and yet 60% do not have life insurance or takaful.
Okay, the bigger question here now is that because I'm sure you've heard this, a lot of people have been saying this, insurance industry is a scam. So how would you like to address that? And what sort of insurance should one have to ensure that at least the basic stuff, like your medical and your life, maybe these two, or just life is enough? I'm not too sure. Yeah.
Yeah. I mean, in a way, it's true. If you have the right insurance policy, it's an asset. If you have a wrong insurance policy, it's a liability. A right insurance policy will cost the least amount because it will only cover what you need, okay? And so it's affordable, okay? So that's an asset. If you have a policy that has a lot of bells and whistles in it that you don't need, it's a liability. You're paying too much. An insurance policy, the premium payment can be many, many years. So the excess you're paying is compounded. Okay, so I talk about myself, and I also, still sponsor the insurance for my family, for my 2 kids, and my spouse as well. So I arrange for this, so they are in different stages of life. So for me, a medical insurance is important, but so is a life cover and a critical illness. So these are the 3 basics, and they're simple. You can buy them online. And an insurance policy online just costs a few dollars a month.
true.
Can be 5 ringgit or 10 ringgit.
Yeah.
So insurance is affordable.
It can be curated to what you are able to
Yes.
afford, right?
And I think that's really the key, that of what you need, understanding your personal situation. Why are you doing it? Because I think that's the question a lot of people don't necessarily think about when they're taking insurance. Why am I taking insurance? Am I taking it because if something happens and I have disability, I need it for that? Or am I taking it because if I die, my children need it? I think a lot of people don't answer the why they are taking it. If you do that, you're able to actually tailor it accordingly. And if you look at, and here in Malaysia, it's a choice. In other countries, in some countries, it's actually mandatory. So it's mandatory insurance. So, and the government controls the prices. So although the insurance is provided by private insurers, the government has regulates how the insurance industry actually charges. And depending on your income, you actually pay premiums accordingly. So if you are like the lowest 30%, your premiums are actually subsidized or paid for by government. And then if you are in the higher bracket and you choose not to take insurance, you pay additional tax. So there are many ways in which we can, I would say, spread the load across to make sure that we have equitable healthcare.
I think the way forward is a base insurance coverage. Malaysia now is looking at that for medical insurance, a base cover that everybody has. Okay, so even the T20 will have to participate. Why you need everybody to participate? So you get the spread. Okay, the T20 can pay the full price. The M40 maybe a small discount, and then as you go down, to the B20 for example, they get it free. Okay, so that will be an equitable system because it links to their ability to pay. Okay, and then if they move from one level of income to another, they can do. So my proposition is not only for medical insurance, but for life insurance. Everybody, for example, over 18, when they become an adult, they all should have a coverage of 20,000 or 30,000. That way, they will have a policy so the education part becomes easier. It's a challenge to educate somebody who doesn't have insurance policy. Because why should they read about it? Why they should understand about it? They don't have one.
I think it's not just hard to educate someone who does not have an insurance policy, but for someone who actually have an insurance policy like myself, even though the company provides it for me, it's just that sometimes the terms and condition is very lengthy, so I don't necessarily know what I'm
What you're
getting
getting
myself into, unless if you have a proper agent. And fortunately enough, I do. So before I was signing up, like I would tell, like, okay, what would this cover? So the critical illness aspect is also very important. That's a lot of people, they tend to overlook that one.
Yes.
So how would you emphasize the importance to actually obtain CI as part of your medical coverage, a medical card?
Extremely important. A critical illness policy can complement or even be an alternative to medical insurance. What it does is it gives a payout based on 36 illnesses, the key challenges that we face, or it could be a shortened version of the big five. They say the big five critical illness: cancer, heart attack, stroke, kidney disease, and organ transplant. That covers over 80% of the claims a person would have. So it's fine. I have 2 critical illness policies. So that tells you I have 2.
Oh.
Okay, both I created myself. One was through the U4Life platform, and now through the Perkeso Sehati platform. So 2 policies that I created. And that's a good sign. When an insurance company staff buy their own policy, I would say less than 10% of insurance company staff buy their own policy. And that's a red flag for me. Okay? So online insurance is totally different. Online is a product that all the staff would buy, or majority would buy. So that tells you already the different value. Going back to critical illness, the beauty about it is that it doesn't experience the regular premium revision. Critical illness doesn't have that.
Okay. Is it because it's the coverage of the type of critical illness is very standardized, or why is it so? Just curious.
It's because it's a longer duration coverage. Yeah, and even though the insurance company can revise the premiums because they are not guaranteed, it's a more lengthy process. And what they do is they actually revise the premiums for the new policies. So if you have an existing policy, that continues. So what critical illness does is it's easier to purchase. The claiming process is easier. You don't need to share your medical records. As soon as the doctor says you had one of the 5, you get a payout. And the best part about it is so affordable. For a 40-year-old to purchase 100,000 coverage, it costs less than 1 ringgit a day.
Oh,
so less than 30 ringgit a month.
Sorry, this is through Perkeso Sehati.
Yes.
Okay.
Oh, interesting.
Perkeso Sehati program. Perkeso Sehati is an incredible program, very underused. I need to just say a bit about it. If you're an active Perkeso contributor, and if you're between 40 and 59, you are entitled to a free screening. This free screening gives you the first health score in Malaysia. So when you do a screening, it's quite complicated. Some results might be good, some might be borderline, some might be bad. You don't know whether you're healthy or not. This gives you a health score. We all understand health score from 0 to 100. The closer you are to 100, the better you are. I'm aged almost 60. My health score is 87.
How old are you? Don't mind me asking. How young? Sorry.
I'm 250 days from 60 years old.
Wow. Oh, okay. Wow.
I count the days.
Okay. Might be all the running, right?
It must be, yeah.
So
cardio exercise.
Yeah. So the Perkeso offers you this, and then there you get this, and from that you get the insurance. You can purchase insurance based on your health score. The better your score is, the more options you have, the cheaper the price.
And that's for everyone across the board.
If you're not a contributor to Perkeso,
Okay.
you're still entitled to 50% discount for the health screening. The health screening is only 145 ringgit, and you can get it across any GPs in Malaysia. So it's easy to get, it's effective, and the insurance is there.
And I think this comes to, though, the use of the system, right? I think we have the tools, but also when you go for health screening, coming back to personal responsibility, it is really important for consumers as ourselves to keep records, because what I've seen is also overuse of systems. I do a health test here, or I do a blood test here, and then, I don't know where those results are, and I'm changing doctor, and I'm going there, or I'm going to do X-ray here. So then you are actually, I would say, even abusing the system, because you're using things that you don't need. So here is where education needs to come in. You do a health screening today, keep your results. You know, when you go and, because that's your baseline. A score is one thing, but also your baseline on what was your, you know, your sugar levels, your cholesterol levels, your creatinine levels. Keep your baseline. Compare that year on year. Are you improving? Are you decreasing? And that will actually help your GP make informed decisions. Because otherwise, when you do a blood test and you don't know what it was 2 years ago, what are you comparing it to? So it's really important for us as consumers to, again, coming to that education, to that baseline. The other thing I also learned, you know, in all the countries I've lived, I have had insurance because it was maintained by the government. So I had to pay for it. But one of the things that was there, and actually I'm not sure if this is something that our consumers know about, is your premiums, if you say, I want everything 100% covered, let's say is whatever, $100, 100 ringgit a month. But if you agree that I will cover and I decide, okay, I can pay, I think the first, I'm willing to pay 2,000 ringgit a year for, or 2,000 ringgit for whatever procedure, the rest I want covered. That's my kind of limit of how much I'm willing to pay. Your premiums actually drop because it's like your car, you know, your excess, right? So I think a lot of consumers underutilize that excess rule, because it can actually save you. If you're going to take insurance for 50 years, calculate it can save you about 100,000. So if you ever use your insurance, great. If you don't, insurance is protection, but then you are minimized. So I'm not sure whether that whole concept of excess is actually used.
I think it's only visible when it's a cashback sort of like system, because I think my insurance provider do provide that kind of thing. Meaning if I don't claim anything for that year,
No,
then
that's different.
Oh, that's a different.
That is totally different. This
Okay.
is, if you do make a claim,
Okay.
you pay, let's say, you decide whether you are going to pay the first 500 month, you decide.
I
So if you say,
see.
I don't want to pay anything if I have to make a claim, the insurer will say, okay, here's your premium. Your premium is, let's say, $100. But if you say, you know what, no matter what, I'm willing to pay the first 1,000, the insurer says, okay, instead of your premium being 100, I'm just throwing out numbers, your premium will now be $90. 90 ringgit. So then you calculate, oh, okay, if I'm paying only 90 ringgit over 10 years, that's going to cost me less than me paying the first
Right.
1,000 when I go in. So this whole concept of access is something I didn't know when I was living here. I
Okay.
learned it there, because there you actually have to inform.
I actually have this. I have my medical policy is One Medical. I won't say which company, but it's One Medical, and I pay the first 1,000. What this means is, I am not going to take advantage of the insurance policy because I have to pay something. So then I'm considered a good claim. So I pay the first 1,000. This impacts my premium I need to pay. It's a 33% discount I get
Oh, for the
paying
entire
the first
total.
1,000.
Okay.
So first 1,000 is not. I mean, touch wood, I don't go to hospital too often, so I don't want to pay the full amount because I might go to hospital once every 5 years or one every 10 years. So I don't really want to pay too much premiums. So I want to what it does is reduce my premium. So I only pay 2/3, and then the other benefit is the downside is I have to pay the first 1,000, which is not a problem.
It's like an upfront for security in the next
I mean,
years
so
to
it
come. I mean,
depends.
it's mindset,
Not everyone
right? Yeah,
can do it. So but it is providing options, because cost of healthcare, as much as we would say we want it to go down or we want the government to provide everything, it is not possible. Cost of healthcare is not going to go down. That's one thing we all have to accept. Number two, there is very few governments, I wouldn't say no, but very, very few governments in the world that can provide everything. We actually have a pretty good baseline system, and I can say this because I've lived in 5 different countries, experienced it all, from the best, and we actually have a great starting point. I think and that's when you asked, have we missed the boat? No, I think the time is now. We spoke about looking at this mandatory insurance. I remember working on it on a policy paper about 20 years ago. Still hasn't happened, so I actually hope we can do it this time.
I mean, to be fair to the government as well, though, like I think they've also been taking proactive sort of like measures by, telling the public that because of the whole premium hikes, right? The insurance premium hike, right? So collaborating with EPF and how you can opt for the account to be part of the payment mechanism. But how can we ensure everyone gets the program? Because if there's no, support, then what's the point?
That is policy change. Honestly, we can talk as much as we want here. We can go and try to educate and so on. But if I look at different countries around the world, what has really succeeded is policy change. And policy change is the one that it kind of makes us do things that we sometimes don't want to do. So there is a lot of learnings we can take because we are, in a way, now doing it. We can really look at examples in Thailand and Cambodia. They have shared systems. So South Korea, that's another one which I think is really their whole culture of preventive health is there from the time they are children. If you go to South Korea, you will actually see that every child brushes their teeth after every meal in schools. After school, after recess, they all go and brush their teeth, right? So that preventive healthcare, their yearly health check. In fact, if they don't do their yearly health check, they really feel like, they are not doing their civic duty. So I think policy change to bring these into it is going to be crucial.
Before we go on to the next segment, I've got a question. You said earlier that 60% of the Malaysian populations, they don't have insurance. Is there a study done? And in your view, why do you think that, that's more than half of the Malaysian population that don't have insurance? So what can we do to actually get them to come in? And I think one of the crucial things you mentioned is what you mentioned as well, medical costs is increasing. Yeah. So how does insurance actually help these people?
Yeah, I mean, insurance industries suffer from the trust element. If you go to a party and you are introduced to a new person and he says an insurance agent, you turn around and walk away. I need to go to the washroom, and you disappear. Right? So there's a trust issue here. That's one, because the image of insurance, expensive products and all of that, that's totally changed with online insurance. Bank Negara now has introduced, as opening up the industry to digital insurance license. This changes the game, reduces the price of insurance by 80-90%. You have to do some work though. You have to read about it, you have to understand. Even digital platforms, they provide customer service, you can call and stuff like that. So it's not so difficult, and then you have to purchase it yourself. So you need to do a bit of work to get the benefit. It doesn't come free. But the cost, why many don't have is one, is too expensive. They think it's unaffordable. They don't have access. And for a long time, we didn't have takaful policies. So, there was all this. But all these solutions I've solved. There's a way, there's a solution for all of this. But the old thinking still remains. That's why I'm proposing that we start to reward certain communities that do good for citizens with a coverage. Who I'm targeting? Blood donors and organ donors. People who give something priceless back to their fellow community. Reward them with a small basic takaful coverage, for example. So this way we will increase the numbers. Malaysia only has 400,000 organ pledges. When a population our size, it should be 3 million. Okay? And then blood donors also, we have 2.3% of the population are blood donors, when we should be, WHO says it should be 4 to 5%. So we are still too few. So by giving them something beneficial, like a small thank you, it doesn't cost so much money, 20 ringgit, 30 ringgit for this small cover per year, gives them an interest to find out more, to read about it, to check, and they have an option to top up. They start to realize, 20,000 coverage is not sufficient, and then they will say, let me purchase more for my family. My needs are higher. So we need programs like that to kickstart the whole process where people start to be aware of insurance. They are educated,
participative,
and then participate. And why do we do it to this group of people? Because they are contributing something significant to the nation.
Right.
I think it comes back to the education and trust, because you say you have to do a bit of work.
Right, yeah.
I have a problem with that, because that means it comes to that postcode effect. Because if you have to do a bit of work, it actually means you're able to do that work. It means you live in a good postcode. It means you are able to find out information. You are surrounded by facilities and services. So I can do the work. But if you really look at the populations, our indigenous populations, our rural populations, how do you expect them to do the work? So honestly, that works for our urban people like us. But if we want to have a system where healthcare is equitable, and that's something I'm really passionate about, how do we bring this to the populations that are most vulnerable, that really need it? And that's why you need policy change. You need regulations. We actually need to potentially look at ways in which we regulate it. the industry and the provision of insurance to the most vulnerable, to our rural communities, so that they are actually able to access it. I mean, giving a free is great, but if they don't understand what they're getting, what's the point? So I really think we need to look at regulating it in a manner that helps us make healthcare equitable for all our citizens.
Interestingly, yesterday the government announced that it is studying the introduction of a basic medical insurance scheme to reduce the growing financial strain of rising healthcare costs in the public. I suppose that's a good start.
It is absolutely. That is the way to go.
Yes.
So now we're going to go to the aging population, long-term care. Malaysia is on track to become an aged nation by 2030. Renu, what kind of long-term care system should we start building?
Well, the good news is the time is right. I always keep saying that, right? The time is really right. The time is now. See, there's two ways. One is the infrastructure that the government provides. So I think healthcare in the home, because as people get older, it's even more difficult for them to get out, to actually access this. So I think really using technologies like telehealth, using what we call Garant technology. So being able to have systems which can detect, like, even your wearables, that if someone has a fall in the home and it can send an emergency system. So I think really looking at ways in which we can engage and help support our older consumers from a technology perspective, and ways that they can understand. Because, we have My Ubat, where you can actually go online and get your medication delivered. But how many 75-year-olds actually know how to do that? So then it's actually helping or training their caregivers at home to be able to do it. So I think technology is one. I think the second way we prepare for the healthcare system is actually people like us, because we are the future aged population, right? We are all in our 40s, 50s, and so on. We are the population that will be around for the next 25, 50 years. So we actually have the ability to start thinking now, how do we work from a preventive health perspective so that we age healthily, and then helping our children live in healthier lives in terms of what we eat, doing exercise, whatever it is, making sure there's movement. So if we are able to bring preventive health and the right healthcare system young, you are helping prepare for that older and aging population. And then even all of this, like that mandatory insurance that we are talking about, that also helps us to build for when we need. Because previously we probably have to plan for 75 years of life. Now you might even have to plan for 90 to 100 years. So it's a lot more of that long-term planning. And I think utilizing, various home, technology, home healthcare systems, mobile health systems, I think that's really going to be very, very
And granted,
useful.
if we actually do have that much runway, right? I know I'm so reminded, because we can't.
But you
predict.
think now.
Yeah.
Think about it
Yeah,
now.
I want to talk about the nutrition and exercise and the My Ubat, things like that. Usually any of these initiatives, 20% of the population understand it, practice it regularly. So we need to build this unity community concept where whatever you know and do well, share with four of your friends. For your friends, family, neighbors, colleagues, whatever. What you do well, share with somebody. So community and unity and all that is so important for aging. Many studies have shown that if you're a loner and you just do things yourself, your lifespan is much shorter than if you have people to talk to, share. So sharing something they don't know is very addictive. There's guys, oh really? And then for that person, oh, you can do it. You're almost the same as me. You can do it, so I can do it. So they don't have the negative, oh, I can't do. If a young person tells an adult, they might say, he can't. But if somebody who knows how to do it, say, oh, it's quite easy, I show you how to do it. And he's so interested. There's no barrier. So helping your fellow communities, whether it's nutrition, some know what to do. If you don't know what to do, it's so complicated. You read the internet, you get confused. And also moving. Malaysia Towerrunning Association, we conduct every Saturday free community training at Menara MPPJ, open to public. And we also provide nutrition guidance once a month and all of that. So we need to have more of this. Okay, and then it's not only relying on the government to do everything.
Right.
We need to start taking initiative.
Civic consciousness.
That's true. And on that, right, because Malaysia is also experiencing this there's a health crisis, like we are very much obese. In the Southeast Asian region, we're the
They're
first.
champions, is it?
We're
Yeah.
champions.
Champions,
Yes,
yeah.
exactly. I think it's lifestyle, right? Lifestyle.
Yeah.
But to say that we don't have access to all these gyms or fitness.
We do actually.
parlours.
We have
Yeah,
really
do.
good facilities.
Yeah. But do you think it's also work?
No, but
Or-
that's why I say it's education. We are now, if we can educate, right, our, not just us, but populations across our country, then that education comes to, where are the two places you learn the most? In school or at home? That's the two areas we have to do it. If you try to tell someone who's now already 70 years old, please go and change it and start doing it, it's too late.
Yeah.
So we need to be preparing now. It's a Korean example that I spoke about, right? They have such a culture, it's culture of preventive health, culture of my health is my responsibility. Yes, if I need a safety net, whatever we have, our in fact government, that's my safety net. But first, my responsibility, educating on what are the implications, bringing in options. I mean, eating healthy is expensive. It's cheaper for me to buy French fries than it is for me to buy grilled chicken.
That's like
that's true, yeah.
my biggest problem. I feel like I got called
It
out.
is expensive.
Right? Like,
So what I've seen, some countries, we have all our local, you make, our local soybean, whatever. I've started to see some options where you have less sugar and all that, but it actually costs more to buy the the product with less sugar.
Yeah, but the
right?
only reason why I ask about lifestyle, especially when it comes to work, because stress levels can actually, the higher levels of cortisol that you have, it'll affect you, right? You'll get bloating and other sort of fatigue issues. Sleep is also one of it. I know outside of the set we spoke about it, but I just want to bring that particular discussion here. A lot of people don't know that your body needs to recover, and sleep is the easiest sort of treatment out
Easiest
there.
treatment, but hardest to do.
Hardest to do.
Especially, one of the areas we didn't really touch on was women's health, because there's been a lot of work and research, mainly in areas and diseases that men have, heart disease, hypertension. Women's health has been underlooked for so long, and when you bring up on sleep, women who are going through menopause, it's one of the biggest issues that they can't sleep. So, how do we actually? There is research that's currently ongoing on that. It's not a problem we've solved, but also ways to diagnose why we are not able to sleep.
But it's not just because of menopause, right? What
That's
about
one
we
for
have
women.
young girls?
But there are others, correct. So for others, areas like sleep apnea, for example, in old days, people don't think like, oh, I don't understand. I'm just sleeping, but I'm not sleeping well. I wake up tired, putting on weight, and so on. So now we're able to diagnose that. Earlier, you used to have to go to a sleep lab. Today, we have technology where you can actually do a sleep test at home. Companies like Philips and Redzuan can actually do it at home in the comfort of your home rather than having to go and stay in hospital. And if your first round of diagnosis says, oh, you need further tests, then you go to hospital. Not everybody needs to go. So all of that is actually available to understand what are issues, why we are not, that's the root, why are we not sleeping? And I know you Ravi, you were talking about how important it is and how we can't catch up, right?
Yeah, you can't catch up. I mean, sleep, now we have wearables, and I look at that. I mean, I struggle with getting enough sleep. I don't have a problem to sleep, but I don't have enough time in the day. I'm doing too many things, getting involved with too many things, and so it generally around 10 to 12 is the sweet spot when you start to feel a bit tired. If you miss that, you start to get another wave and you're awake. Then it's so hard to sleep. So the first trick is the moment you start to feel that sleepiness between 10 to 12, go and sleep. Get up early if you need be. So that's what the first thing that we need to do. Okay, and then also make sure your room environment is perfect.
Oh, the sleep
It's
hygiene
dark,
lah.
it's cool enough. It's not much distraction. It's comfortable. It's inviting you to sleep. Get a routine. I mean, I drink green tea at night. I have a shower. So you have a routine when you get it. And
No, I'm
that's
very-
what
I
matters.
struggle with this because for me, I do my best work after that period. So I know all of these
Right,
rules, but I actually struggle to.
No, you're not alone. Me too.
That's the best time I work too, because when you have a bit of pressure, you have just a few hours before you need to sleep or whatever, then you tend to work super efficient. And so yes, I suffer from that too, but you need to change it, because today's science tell you, for example, I mean, not only the sleep part, but the other part that we lose out too, Malaysians, is hydration. We don't
Okay.
drink enough
Enough
water.
water.
I mean, I remember when I was in school, the Chinese used to go around carrying this Tupperware everywhere they go. They're the smartest.
So it's actually quite true when they say there's this saying whereby like Asian moms will always tell you drink enough water
Yes.
because it'll heal everything.
Everything.
Especially because of
It's,
hydration.
it's actually true.
Yeah.
I used to laugh at
Yeah.
that.
Yeah.
But it's
Hydration
true.
is-
Actually, I've got a question, very interesting. You talked about sleep issues and obesity and all that, right? I realize kids these days, primary and secondary, they sleep less than 5 hours. And why? Because firstly, after school, you got tuition, extra classes, right? And then gadgets.
Gaming.
There's a lot of gadgets. So after extra classes, they play gadgets, and then by the time they sleep, it's 1, 2 in the morning, and then they have to wake up at 5, 6 to go to work, go to school. Sorry. So is that also, the cause of all these health issues that's rising in
Absolutely.
Malaysia?
Yeah.
Probably
Not
around
just
the world
Malaysia,
as well.
around
Probably
the
around the
world.
world. Yeah.
But
I-
that's parents. I mean, I'm sorry. I mean, at the home, that's parenting. I mean, government can say all sorts of things, like just what Ravi knows. He's just listed out all the right things to do. We all know that we shouldn't be playing computer games till 3 in the morning because you're just sitting there and doing it. So I think, I've seen where parents actually implement certain structure, certain discipline is pretty important.
I was 92 kg 15 years ago. 92 kg, yeah, obese. So the trigger point for me was when my father had a heart attack. And when I checked the history, on my father's side, there are 10 brothers and sisters. Everyone had a heart attack or stroke before the age of 65. And I'm 60. So I told myself, I'm going to make sure I don't fall under the same pattern. So I needed to take charge of my health. When you are unwell, you have two choices. You can go to hospital and they can cure you, but you got to pay a lot of money. Or you do it now. You take charge of it. It doesn't cost any money.
That's
You
the
have a choice.
Yeah, that's the preventive mindset.
So,
that we
so
have. Yeah.
what do you want to do? And if you don't know what to do, no problem. There are many people who do. Just choose your friends. They say you become a part of the 5 closest friends you have. So if you have a problem that you want to solve, go add that extra friend into your circle.
Yeah. And bringing that preventive mindset again, not just in our urban communities, but equitable healthcare, whether it's in our kampong or in our high-rise condominium, as a nation, wanting to have that self-responsibility for our health, wanting to be a healthier nation. I think that's just so important.
We have like one final question, one lightning question, I suppose, for each of our guests. If you would be able to come up with one health metric for Malaysians to have, at least, let's not even say the next 10 years, this year, that they can do immediately, what would it be? We go to Renu first.
Walk. Just walk. I would say that's the first thing you do, because if you are sedentary, it's been, whether it's your 10,000 step flights, it doesn't matter. I think walking is one of the first things you do, and be very aware of what you're eating. If I want to eat a piece of cake, it's fine, but I need to be aware that I'm doing that and why I'm doing it. So I think one is walk, and I think one is question, is what I'm doing something, maybe it gives me joy, but is there some other thing? So I would really say walk, think, educate yourself.
Should we count calories? I'm just curious because,
I've tried everything by the
Yeah.
I work in this, I've tried everything.
No, I would say you don't need to start counting calories.
Yeah.
You need to start by
think.
cutting down 1 fried chicken, cutting down 1 cake, drinking more water. You need to start that first. But my one point is the same, movement. I mean,
I
what
think
Renu
movement's
says
really important.
is so true. The 10,000 steps has been proven with so many research. 10,000 steps, WHO says, is the minimum. Maybe not 10,000, maybe 7,000
Yeah.
is the minimum. However, there's a challenge of walking 10,000 steps. It's easy to do, but it takes 100 minutes to walk 10,000 steps a day. If you don't achieve any steps through your day, work, or whatever, to just want to do that in the evening will take you 100 minutes, almost 2 hours. The alternative, which is even better, walk up the stairs. You only need 20 minutes.
Oh,
To get the benefit of walking 10,000 steps, you walk up the stairs for 20 minutes. That's all. 20 minutes is 1% of your day. If you can't find 1% of the day, then there's something wrong with you.
But I think it's any movement. It could be swimming, because not everyone can do steps
Yes.
because
If
of
you can't do
knees,
other
right?
things, it's fine. Yes.
So I think it could be swimming, it could be a gym, but I think moving, and taking that responsibility to do that yourself.
Yeah, even stationary, but you're doing some
Something,
Pilates.
right,
That's
yeah.
good too, right?
That's perfectly fine.
Yeah.
Whatever,
Anything. Correct.
whatever makes you
Movement.
happy.
Yeah.
Whatever.
What
Yeah.
about you? What's one health metric that you wish for Malaysians for this year?
As what Renu said rightfully, it's more walking. You know, if you don't like to go to the gym, you don't like to do exercises or things like that. Walking is the best, and within your neighborhood as well, just walk up,
Yes.
and
Yeah.
that's it.
There is I think one of the insurance companies in Australia, if you do 10,000 steps a day, they track it on your tracker, you actually get a reduction in your premiums. I think some of them have tried doing that here, right? So that's actually linking, I guess, healthy activities to.
We actually have to really look into that particular concept,
Yeah.
right? Yeah.
I mean, we can do many things. You can track now. There has to be a few who will cheat, but you can reduce the numbers. If you do that in 1 week or certain targets you achieve, you can get 10% off your next grocery or things like that. This is where companies can bring in ESG concepts, the social part of ESG, to help community move in the right direction. We're not doing enough in prevention in Malaysia.
Yeah, I think a few years ago, the Singapore government, the Health Promotion Board, gave maybe not
They still
every
do it.
citizen, but yeah,
They still
you
do it.
actually get, because the trackers are not
the
expensive
trackers,
nowadays, gave everyone, or a very large number, to say,
Yeah.
do and
Conscious
start
steps.
tracking.
Yeah.
Yes.
That's it.
Actually, now you don't even have to have that. You have your phone. Your phone
Yeah.
is counting the steps. You have your phone with
Up to
you.
you. But I think for me, it's also important that this goes, I keep talking about equitable healthcare. Not just here, not just among us who,
In
have
general.
the opportunity.
Understood.
We need to take it to all our postcodes.
Yes.
Great.
And with that, I'd like to thank both our guests, Renu as well as Ravinder. Thank you so much for your insights, your passion, and your climb. Thank you so much, both.
Thank you. Thanks so much for having us.
Thank you.
Thank you as well, Sharen, for being here.
Yes, and to our viewers, remember the future of healthcare isn't just about hospitals and medicines. It's about what we build together every step
Correct.
of the way.
Yes.
Thank you.
And as well, don't forget to also like, comment, and subscribe if you do like this particular episode. Don't forget to also turn on the notification bell. If you haven't already, you'll not only get NST Beyond the Headlines update, other NST Online's news reports will be delivered to you. My name is Amalina Kamal, and we'll see you next week.